Good day to Sir Izzuddin Faris. My name is Sharifa Zahara and my group, Mariana Chong, Nur Aina Sabrina, Alia Natasha, and myself will be presenting to you the sports-related injuries in common injury. Our group's chosen sports is cycling or cycle sports. I will start and briefly explain the introduction of cycle sport. The cycle sport or cycling is a competitive physical activity, a recreation, and transportation involvement which was introduced within the 19th century. It is both a professional and amateur event that primarily hosted in continental Europe and has been popular as a sport and a leisure activities in Malaysia, around the national parks and countrysides. The elements of benefits can be covered within the health benefits, recreational benefits, and economic benefits. Cycling not only helps to lower the risk of certain health and stress problems, but also affects as a rehabilitation for surgeries, such as hip surgery. It is also supports the positive effect as the stress-free activity during leisures. Lastly, transportation aspects are the importance for individual efficiency, such as simpler parking slots and the accessibility bike lanes in highways and countrysides. Despite the list of benefits, there are some identified common injuries that actually and will occur as one disregards the dangers of the sport's usage. The occurrence of common or severe injuries in general can be caused by the other parties or the individuals themselves. The common list that was identified and will be covered are within four injuries, which are wrist pain, foot pain, knee pain, and back pain. Without further ado, I will continue with the first common injury, which is wrist pain. Again, I am Sharifa Zahara and will be presenting on the first common injury, which is the wrist pain. It is not a surprise for the common injuries of the cyclist will be the wrist, as it is the body part where it holds the handlebars for the cycling sports maneuver. It is described as a long-term chronic injury caused by persistence of stress on a bodily component. Based on general knowledge, the wrist is not one joint, but it is made up of several small joints where the bones of the hand and forearms meet. Within the wrist pain, there are a few specific names and pain which occur through cycle sports, but the ones that I'll be highlighting is the carpal tunnel syndrome. Carpal tunnel syndrome is a narrow passageway in the wrist which is formed by the wrist bones and ligaments. It occurs when the median nerves experiences greater pressure as it travels through the carpal tunnel that travels down the forearm and into the hand that is being squeezed by inflamed tendons or ligaments thickened and putting pressures on a nerve. It is believed to happen from the excessive pressure when riding while gripping handlebars, keeping the hand curled up and forced against the handlebars for a lengthy period of time, and in the repetitive motion. The symptoms of the syndrome can be as average as a tingling or pins and needle sensation, numbness, and weakness in the thumb, pointer finger, middle finger, and a part of the ring finger. Despite the negatives, there are a few and suitable treatments that can be conducted based on the differences in stages. In the early stage, the simple things that can be conducted are to take a frequent breaks to rest the hand in avoiding the symptoms to be worsened, and the cold packs application to reduce swelling and inflammation. Despite the simpleness, delay in treatment can result in poor healing and limited range of motion with long-term impairment. In the moderate stages, also known as non-surgical treatment, such as wrist splinting, medication, and corticosteroid. The wrist splinting can be worn in nighttime, which holds the wrist motionless to relieve the numbness and movement which causes irritation, similarly as the medication usage. The last resort is in the moderate stages is the corticosteroid, where injection of cortisone given by the doctors into the carpal tunnel through ultrasound to alleviate discomfort in swelling. In the severe stages, it's known for surgery, procedures where the damaged area does not respond to any earlier treatments. Endoscopic surgery and open surgery are the two procedures used to accomplish surgery. In the endoscopic surgery, the surgeon will either be using the endoscope of the tiny camera or the ultrasound to see inside your carpal tunnel and guide the tools that cut the ligament through one or two small incisions in your hand or wrist. In the open surgery, the surgeon will make an incision in the palm of your hand over the carpal tunnel and cut through the ligaments to free the nerve. Other than the treatment, there are a few lists of prevention that can be the aid for the carpal tunnel syndrome, despite being difficult to avoid. There are a few suitable prevention for the syndrome, such as the bike fit inspection and the usage of protective gears. Firstly, a poorly fitted bike is frequently the source of numerous aches and pain when riding, including hand and wrist problems. Bike fit inspection should be conducted before using the equipment to prevent any long-term or short-term injuries in cycling, such as saddle height measurement and handlebars adjustment. Secondly, wearing the correct gear substantially decreases one's chances of getting hurt, allowing one to focus on the game rather than worrying about the potential mishap. For example, padded gloves and padding around the base of the thumb for strain reliever. That is all from my part in the wrist pain as one of the common injury, and I will pass the slides to the next presenter. Thank you.
Assalamualaikum and good day to Safaris Izzuddin. Before I start, my name is Raina Sabrina and I'll be explaining my part, which is foot pain or plantar fasciitis that affects a lot of cyclists. So foot pain is a feeling of soreness in the foot caused by abnormalities or injuries to any of the foot structures, such as bones, nerves, muscles, blood vessels, or connective tissues. Foot pain can be caused by ill-fitting footwear or poor shoe position and might be the result of the underlying foot alignment, such as plantar fasciitis. Plantar fasciitis is a disorder that affects cyclists and others who engage in activities that put a lot of stress on the palmar, which is the underside part of the foot. Acute and chronic are the two forms of plantar fasciitis. Acute refers to a condition that can be brought on by a specific damage. It is also referred to as an acute form. There is also a chronic form of plantar fasciitis, also known as the typical case, which gets worse over time. On to the next slide, which is the causes of plantar fasciitis. Plantar fasciitis is the medical term for this condition, which is quite frequent among cyclists. When plantar fasciitis is ignored rather than treated, it can fail to heal correctly. Chronic heel discomfort can be caused by a bony spur at the exact place where the plantar fascia meets, which is the part of the heel bone. Plantar fasciitis frequently occurs for people who is overweight or obese. Because of the increased pressure on the foot, people who are overweight or obese are most likely to develop plantar fasciitis. Foot structure is a part of the causes of foot injury as well. Plantar fasciitis can develop to people who has a structural issues with the feet, such as very flat feet are in high risk of developing foot injury. A strain to the tissue caused by a specific activity, such as cycling or running, one of the most typical causes. Move on to the symptom. At an early stage of plantar fasciitis, pain is often felt first thing in the morning. The pain usually fades throughout the course of the day, only to return the next morning worse. Walking and running might be tough with plantar fasciitis, heel pain after exercise, or any sport activities such as jogging, cycling, or running are a few examples. Plantar fasciitis is categorized by increased pain along the arch or heel of the foot as a result from activity or exercise. Any swelling in the arch, heel, or foot can be a sign of plantar fasciitis because plantar fasciitis is defined as inflammation of the plantar fascia. Move on to the treatment. Suitable treatment for plantar fasciitis, which is there are simple things that we can do to solve the problem in the early stages, which is use cold pack to minimize swelling and pain. Stretching and strengthening exercise can help with plantar fasciitis treatment. It's especially crucial to improve calf muscle flexibilities. Stretching techniques that are commonly employed include wall stretches and curve or stress stretches. Strengthening, we can use towel curls. To do a towel curls, the patient sits on a smooth surface with his or her foot flat on the end of the towel, like on the picture itself. Lastly, switching to correctly fitting appropriate shoes may be beneficial. According to a study, 14% of people who has plantar fasciitis, changing their shoes was the best treatment for them. On to the next slide, which is suitable prevention for plantar fasciitis. Finding a comfortable pair of soft and supportive pair of cycling shoes can go a long way toward preventing foot problems. A general physical examination by a physician will assist you in determining the type of foot ailment you have, as well provide advice on rehab exercise on how to manage your symptoms. Fast side shoe orthotics are a type of insole that can prevent and help to avoid plantar fasciitis. Lastly, eating a well-balanced diet that includes food in high in particular nutrients and anti-inflammatory characteristics will help you avoid plantar fasciitis. That is all for me. Thank you so much.
First of all, a token of gratitude to the previous presenter. Hello and good day, Safaris. First of all, let me introduce myself. My name is Marina Chong, and it is an honor for me to introduce you to the next common injuries, which is the lower back pain, the lumbar regions. So where is this part of the lumbar regions? As you can see from this picture, from the red highlights, that is where the part of the lumbar regions is, and from the lower back, for your lower back pains, the culprit of it. So for this cycling activities of sports, it actually has a low rate of injuries, more than other sports such as volleyball, football, and so on. But in this case, lower back pain has the higher rates of complaints, both novice and professional cyclists, okay, based on the studies. Of course, we would logically we would think it was most of the common injuries is wrist pain, knee pain, and leg pain, but in reality is actually the highest rate of the complaint, which is the lower back pain. So as you can see, this sports of activity is quite popular back then, where it is actually introduced, where it will help you to reduce your back pain if you do this type of sports, which is cycling. But if you actually didn't do it properly, it will actually lead to the opposite of health. So such as we can see here is that you have a poor bike fitting, such as the handlebar is actually so far away for you to reach it. It could actually you would tend to lean over with your back arch, and your head will slightly tilt up. So if you don't notice this type of process, that will lead to a lower back of your injuries. It will also leads to the wager's hump. So the riders should actually take a good care of their backs. So it's actually a worst case scenario, such as anatomical causes like leg length of discrepancy or misalignment of spine, such as scoliosis, which actually causes the lower back pain, but it's actually depends of the person. So how would you actually know these symptoms will come up from your body? So if actually from for a long ride of your bicycle, and when you got off your bike and you try to straighten up of your spine of your back, you will actually struggle a bit to make it straight. So that is where you know that you will have a lower back pain. You will slightly feel there's a throbbing pain of your lower back pain. Other than that, maybe you will feel like a stabbing type of pain, but actually depends. But yeah, of course, it actually easy to detect and identify. So how would you actually treat this lower back pain? Of course, first of all is home care and remedies. Because this injury is actually not that type of severe most of the people, most of the case, because after a long time of period of time when you rest and don't do any heavy type of activity, the pain will go away. All right. But if that pain actually have really discomfort type of pain, you should actually take over-the-counter type of medicine, OTC, such as ibuprofens and Tylenol medicine. But if you have a very severe type of lower back pain, you should you should actually consult with your doctor. So how would you prevent this lower back pain of yours? First of all, of course, you should exercise. As you can see from this lovely gentleman, you should do a plank. That is one of the exercise. Other than plank, you should do the founder, the woodpecker. Basically, activity that focus on your hips. Okay, this will also leads to your core strength to be strengthened. So that you won't actually put a stress and pressure only that one part of your body, which is your lower back pain. Other than that, you should check your seats and also your bike fitting. So where you can see is that you should see in front of the mirror. You should see at the bottom of the pedal stroke on 6 o'clock. You should have a tiny bend on your knees. Okay, but if this type of position actually make your legs straight, okay, you should lower your seats to 25 to 35 degree. Okay, next is to maintain a good posture both on bike and off bike. If both of these are actually not alignment and is not actually alias, it will make a lot of difference. Okay, so you should remind your body to maintain a good posture so that it won't actually again stresses your back of your body. So that is actually all from me. Thank you.
Hi and a very good day to Sir Faris Izzuddin. My name is Alia Natasha and I will be presenting about knee pain and patellofemoral syndrome. Next slide, please. It is common that every cyclist from beginner to cross encounter knee pain at some point throughout their riding period. Knee pain is the second most common muscle and joints injury in cycling. Usually, knee pain is caused by a disease called patellofemoral pain syndrome. This condition is usually triggered by athletic overuse of high impact use of the knees, and that give pressure of the knees limitation. The mistake that cyclists frequently do is they think that they are in the right position and constantly maintain in the same cycling position. And then they start to feel strong pain on the knee afterwards. Generally, the knee pain does not come from the knee itself. The pain that comes from the knee is made up of several small joints where the joints and muscle from all areas meet when the lower kinesthetic chain is disrupted. Next slide. The symptoms of knee pain and patellofemoral syndrome is the most ordinary symptom of this pain is dullness. It started by feeling itchy pain in front of the knee, and it normally occurs slowly and frequently get worse when cyclists do not realize the symptoms at first and still continue cycling. These symptoms get worsened when you do activities that require a lot of knee bending, for instance, squatting or climbing stairs and cycling. Symptom of knee pain is vary depending on which structure is implicated. When a knee is infected or inflamed, the entire knee can become swollen and painful. Knee injury also make your knee joints to move slowly, and also it can be difficult to move the knee to walk, stand up, and perform other daily activities too. Next slide, please. The treatment that the patients can do is they need to rest as much as they can by not using a lot of pressure on knee. If necessary, patients can take pain reliever such as ibuprofen or naproxen sodium to release the unbearable pain. Secondly, other suggested treatment is by do specific exercises for the injured knee. Thirdly, by putting ice on the injured part can also help to recover, as ice can decrease inflammation and numb pain in the injured area. Furthermore, if non-surgical treatment does not work, patients will have to do surgery on the knee, realign the angle of the kneecap or to relieve pressure. Other treatment that can be used is CT scan by doing ultrasound. In some cases, if the knee is damaged, there is more likely that they have to do the partial knee replacement surgery or total knee replacement surgery. Okay, next slide. How to prevent the knee pain and patellofemoral syndrome is you can start it by changing your daily routine and do some like exercise. By temporarily stop cycling within the recovery time is also important to give the knee fully recovery. Furthermore, taking care of your body weight, eat healthy food, drink plenty of water is obligatory to put less stress on the knee. Thirdly, before you do any light physical exercises, try to do warm up thoroughly before you start exercising and make it habit to stretch after you're done with physical exercises, as it helps by increasing your flexibility, lower your change, lower your change of injury and relax your muscles. Okay, next slide. All right, that's all from me. And these are the resources that we refer in doing these researches. To summarize, there are pros and cons in cycling. It gives you healthy body, can be reduction of stress level and etc. etc. But it can also give you nightmares when you started to get injured within the cycling periods. Just now, my group mates and I have presented some common cases in cycling, which are wrist pain, foot pain, back pain, and knee pain. With this knowledge, it will be beneficial for us to practice with. And that's all from us. Thank you.